Welcome to Everyday Nursing Knowledge Lectures, and today we will learn treatment of acute hyperkalemia. Normal potassium level in our blood is 3.5 to 4.5 or up to 5 millimole per liter. You call it as hyperkalemia if potassium level goes beyond 5.5, and if it goes above 6.5, it can cause arrhythmias, irregular fast heartbeats. And in the EKGs, you can see peak, tall T wave. PR interval can get prolonged. There is changes in the ST segment, and if it is hyperkalemia is not treated, it can lead to widening of the QRS, arrhythmias, and asystole. So hyperkalemia requires immediate medical treatment. Now let's see what are the causes of acute hyperkalemia. One is kidney disease. Kidneys helps to filter potassium and remove potassium by urine. So in patients with acute kidney disease or end-stage renal disease, there is always a risk of acute hyperkalemia. Second is certain medicines. Some of the examples are potassium-sparing diuretics. Diuretics helps to remove sodium, water, and potassium from our body. But if it is potassium-sparing, it keeps the potassium and removes sodium and water from our body. Example, spironolactone. Another example is ACE inhibitors. Example, lisinopril. ACE inhibitors decreases the secretion of aldosterone. Aldosterone helps in the reabsorption of sodium, water, and it helps in the excretion of potassium. So when aldosterone decreases, potassium excretion decreases. As a result, potassium level in the blood can go up. Third is diet high in potassium. This is seen in patients with kidney disease, especially diets like banana, orange juice, spinach, grapefruit, potatoes, etc. can lead to acute hyperkalemia. Third cause can be diabetes. In poorly controlled diabetic patient along with kidney disease, these patients are at risk for hyperkalemia because insulin in our body helps to move potassium from blood into the cells. So in diabetes, either insulin deficiency or body is resistant to insulin, so there will be little insulin which can help to move potassium from blood to the cells. As a result, potassium level in the blood can increase and leads to acute hyperkalemia. Another cause is acidosis. In acidosis, the pH of the blood is low. That means there is excess hydrogen ion in the body or excess hydrogen ion in the blood. So body try to normalize it by moving hydrogen ion from blood into the cells and in exchange of potassium. So potassium from cells moves from cells into the blood. As a result, potassium level in the blood can go up. Another cause of acute hyperkalemia is salt substitutes which has potassium or potassium supplements. Now let's see the treatment of acute hyperkalemia. First is calcium gluconate or calcium chloride. You give 10% 10 ml IV over 10 minutes. So it is not to bring down the potassium, but this calcium helps to protect the heart. It helps to stabilize the heart. It stabilizes the cardiac resting membrane potential and thereby decreases the risk of arrhythmia which can be caused by acute hyperkalemia. Second treatment is short-acting insulin, that is regular insulin with dextrose. You give regular insulin 10 units IV along with dextrose 50%. Insulin helps to move potassium from blood into the cells. So when you give insulin, it moves potassium from blood into the cells and it brings down the potassium level. Now along with insulin, you give dextrose. This is to prevent hypoglycemia. The third treatment is sodium bicarbonate. Sodium bicarbonate also helps to move potassium from blood into the cells and it can bring down the potassium level. Fourth is beta agonist, example albuterol nebulization. Same like other treatment, it helps to move potassium from blood into the cells and it bring down acute hyperkalemia. Now these all are temporary measures. To remove potassium, it has to be removed through urine or through bowel movement. For that, another treatment is loop diuretics. Loop diuretics helps to remove sodium, water, and potassium from body through urine, but this works only in patients with normal renal functions. Another treatment is cation exchange resin. Example, 𝐾𝐧𝐿ate. You can give 15 to 60 gram orally. It lowers the potassium in the intestine and it promotes and it excretes potassium from the body through bowel movement. Now, if this pharmacological management fails, the preferred method of treatment is dialysis to remove potassium from the body. Other measures involved Veltassa or Lokelma. Just like 𝐾𝐧𝐿ate, it binds potassium in the intestines and it promotes potassium excretion. But these two treatments cannot be used as an emergency treatment or treatment of acute hyperkalemia because it has delayed onset of action. It can take hours or days for its action. So today we learned about treatment of acute hyperkalemia, and thanks for watching my video.